In this training video, I'm going to go over the changes to care guidelines, which will take effect over the weekend. So you will probably open NextGen on Monday, November 5th and see these changes. You'll still access care guidelines from the same templates. You'll have the link and the red number indicator that tells you how many care guidelines are due. Clicking on the link will open the care guidelines module. And this is where you'll see changes. Care guidelines have been updated to reflect a paged view, which is what they're calling this main section here. So I'm going to start at the very top. The diabetes managed elsewhere checkbox has been moved to the very top of the page. The functionality hasn't changed with this checkbox. If a patient has diabetes in their problem list, it will auto apply the diabetes care guideline. But if that diabetes is managed elsewhere, they're receiving care elsewhere for that condition, checking this box will at least exclude the patient off of any outreach reports. So it will not remove the protocol items from the main view, but outreach will not take place. Moving over to this left-hand navigation section, you'll notice this patient has diabetes and health maintenance care guidelines applied. If I wanted to see the protocol items in this main view for just one of those care guidelines, I can click on the care guideline. In this example, I'm clicking on diabetes. And you'll notice that my main menu is changed to show just the diabetes related care guideline items. If I clicked on health maintenance, it will show me just those protocol items related to health maintenance. And if I wanted to see everything related to this patient for all applied care guidelines, I would select show all, and then you'll notice everything move back in. Next, I'm going to move over to the right to the care guidelines panel section. And the first thing you'll notice is the PHQ-2 and the PHQ-9 links are here. So that will bring you to the PHQ depression screening. Next, you'll see the cognitive assessment link that will bring you to that assessment. Grid view will just give you a different view of this page. And clinical guidelines history will show you the full history of any care guideline items that have been completed or excluded in the patient's chart. I'm going to move down a little bit further and go over the header section. So you'll notice the guideline, next due, status, and last completed headers are blue, and if I click on one of those links, I can now sort by the column headers. So clicking on guideline will sort the guideline column in alphabetical order. I can click on next due, and it's going to pull in the next due date. Status will sort by status. If I click on that twice, you'll notice it'll pull up things that have been ordered and what's next due. And then last completed, if I wanted, I could search by the last completed date for each care guideline item. Comments, you'll notice it's a new field. You can free text in comments for any care guideline by just selecting the care guideline and adding information in this comments field. And that will save and close if I were to save and close out of the care guidelines, but I am not able to sort by that column. So I'm going to switch this to sorting by status. And I'm going to drop down one more level to the actual protocol items. So you'll notice with this very first one, the mammogram, there's this additional text in blue right beneath the item that's telling me the current interval applied. With the mammogram item specifically, you'll also see this little warning indicator. And what that's identifying is that there's a modified interval applied to this specific protocol item for this patient only. And to do that, so what I'm seeing here is what is currently applied. When that indicator exists, it means something's been customized. To view the current interval and even make changes, I would just click on this text here, and it will pull up what the current interval is for this patient and what the default is. So what we already see because of that indicator is that something has been customized, and that is because the standard interval is for this mammogram, it should occur every 2 years starting at age 50, but the custom for this patient is a 1 year interval. And you also notice I have the option to restore default if I wanted to change this back to the default, which would be the 2 years, or I can leave it as custom, but it is giving me that indicator. In this case, I'm just going to cancel. And then if you'll notice, if I go to the next example, so the diabetes eye exam, for example, I can also click on the text below that item, and I have the option of changing the current interval. Excuse me. If I were to change the interval in this case, you'll notice as soon as I made that change, it will remove the default and identify this as a custom item, which would then apply that same indicator icon. I'm going to cancel because in this test environment, this screen specifically has been taking about 2 minutes to load, so I don't want to take that much time up on the video. Okay, so we went over the care guideline protocol item, how to identify if a custom interval has been applied, and how to customize an interval that already exists. Next, you'll see the due date for the item, and then the next column over is the status. So from this status column, if you click on that pick list, you have the ability to update the status to completed, performed elsewhere, excluded, declined, or hold testing. So you would select the test. So let's say with this mammogram, I'm going to complete it. I can select the mammogram here, and I actually have the option of identifying that it was performed elsewhere, excluding, declining, or holding, but I'm going to start with the completed option. And what it's giving me is the current list of orderable tests that would complete this care guideline. So if it exists in this window, I actually can select that test here, note when it was completed, and add additional information, or just put, see results or see document, and I can save and close. As long as a care guideline item is attached to an orderable, it will complete and that status will carry forward. And I apologize for the time. It takes a bit of time in this test environment. But what you will notice is that item is now no longer at the very top of my list. If I page through, so I'm on page 1 of the care guidelines list, we'll now see that mammogram has a new due date because it is set to recur every 1 year. It now has an October 29th of 2019 due date, and it's showing completed and the last date that it was completed. So I'm going to go back to page 1, and with the next item I just want to go over a few other status types. So that was completed. If I were noting that this were performed elsewhere, it's very similar. So this is the list of orderable tests that we have attached to this care guideline that will satisfy the care guideline for now. So I would do the same. I would select the test, note the date it was completed, and add additional information if necessary, and save and close. Because this can take up to a minute to refresh in this environment, I'm just going to cancel. And I want to show you just one more option. Next thing you would have is excluded, declined, or hold testing. I'm going to just select decline because the processes for excluded and declined is very similar. So again, I would select the reason, and you'll notice that item also left this main page because the status has been updated. So if I did want to make sure that updated as I expected, you'll see that diabetes eye exam is now at the very bottom of my list, and it has a status of declined, and that will carry forward to future encounters. So that's updating the status. It's just important to remember, if you are noting from this window that something has been completed or performed elsewhere, it will pop up a list of linked tests or procedure codes that would satisfy the care guideline, so that you can complete or note that an item was performed elsewhere from this module without going into another template. Next, I'm going to go down to the bottom and go over the add orderable and add update reminders. Add orderable will allow you to add a specific test or any test or procedure that we already have in our care guidelines menu. And what's nice about this is you can add this at the patient level. So if for this patient specifically, I wanted to also have a care guideline applied for a breast MRI. And I'm just, for the sake of time, just going to pull in a diagnosis code that may not be relevant at all. But so you will select the item you're ordering. You will have to attach it to a diagnosis code, and then you can set up your own interval. So if this is something that I want to have happen for this patient specifically, a specific amount of years, I can add a start date or start age, sorry, and a stop age. And I can even add a start date if it were appropriate, but I can add at this point. You'll see this new guideline item applied just for this patient. Save and close, and you'll see it's now listed amongst my due care guideline items. I can even, excuse me, click on that interval link. And one thing that's nice, if this is just something that you don't really need it to recur, but it's an item that you want here for the next time the person comes in, so that anyone that's treating that patient, if it's not you, when they go into their care guideline items, they'll see this item, even if it's just once. I can ignore this interval altogether and just say, just the one time only I want this to happen. So what's nice about this, rather than maybe sending a tickler or a task to someone, is it's accessible to anyone that goes into that patient's chart, and it will show on their care guidelines. So this is going to take about a minute to close. I apologize for the wait. But again, just to restate what happens with the intent of the customized orderable option is you can create at a patient level a care guideline protocol item. You can even customize it to occur once or to recur over time. And that will show as a care guideline indicator when it does become due. And what's nice about it versus sending a task or a tickler or some type of recall item is that it will be accessible to anyone opening that patient's care guidelines. Similar functionality is with the add update reminders link. This will allow you to add in just a free text, and maybe it's that you want to talk to the patient about something, but you want to do it at their next visit. So maybe it's not so much a test or something that you're ordering, but important enough that you want it in the care guidelines and you want it to show as due at a certain period of time. And again, maybe you're using this option instead of a task or a tickler to a team because you want to make sure whomever's the next person or whoever this patient sees in the future at the organization, that this reminder's in there for any care team that may see the patient or treat the patient. So maybe here I just want to put discuss so maybe it's just something I want to remind whomever's treating the patient. Maybe it's not my patient. I can put a due date. So if this is something that I want to occur, maybe not today, but by a specific time period. And I can even task it. So I can have this as a care guideline item, which will show as due when it gets to January 31st of 2019. But I can also task it. So if I also wanted this to go to the triage team or maybe the nurse educator, I could even task this to that person. In this example, I'm just going to send it to the next gen admin. And I'm going to add update and then save and close. So I put a future due date on this. So I'm going to go to the next page of my care guidelines. There it is. So I just added a free texted reminder to discuss the diabetes patient education at their next visit. Um, it's putting in the comments section that I did task this to someone. This will show up in that person's task list on that date. So, or today, but with the due date of January 31st. So there is a chance it can get buried in your task, which is why I think it's kind of nice to have it also as a care guideline, because then it will pop up on January 31st as a due. It will count as a due item. To remove reminders, so I've ordered added a personal reminder. If I were the person coming in to resolve this, you have to go back into that add update reminders link, select the item, and then mark it completed. So that may not be the most efficient process, but that is currently the only way you'll be able to remove that item from the care guidelines once it's resolved. If you don't, it won't hurt anything. It will just appear in your care guidelines list. So those are the changes in this care guidelines module. I'm going to quickly recap because I know I moved around quite a bit. Your diabetes managed elsewhere link has been, or checkbox has been moved to the very top. Checking on this box will remove patients from your diabetes outreach. Any outreach reports. The left-hand side is showing me care guidelines applied. Clicking on a specific care guideline will filter my main view to show only protocol items related to that care guideline. You'll notice because I did add a personalized orderable, so a personalized test, if I click on that link or that selection from my applied care guidelines, I can see just anything I've ordered personalized for this patient. And the same with that reminder that I created to discuss patient education. Clicking on that applied item will show me just that related protocol item. Again, I can switch this back to show all the care guidelines items. From the care guideline main view, I have the ability to get to my PHQ, cognitive assessment, or I can view this window from a different display, and also view my care guidelines history. Additionally, I can sort by my column headers, so I can select a column header to sort by that column. Going down the next level, I can select a specific care guideline item and add comments. I can also modify my intervals for a care guideline within a patient's chart by clicking on the interval link. I can change the status of a care guidelines from the status pick list. Selecting completed or performed elsewhere will prompt me to attach a test or an orderable item that will satisfy the care guidelines. Once saved, completed, performed elsewhere, or really I should say any status from this window will carry forward to subsequent encounters. And I can add a personalized orderable at the patient level or an update or reminder that I can then task to another user if needed. That is the end of the care guidelines demo.